3 years ago, President Obama released the National HIV/AIDS Strategy. The strategy is the nation's first comprehensive, coordinated approach to reducing the number of new HIV infections, increasing access to care, and improving outcomes for people living with HIV, and reducing HIV-related health disparities.
The President is committed to a national HIV/AIDS strategy that is grounded in the best science, which now tells us that early treatment is better for the individual's health, and treatment can also reduce the risk of HIV transmission by as much as 96%. So treatment is also prevention.
Since the strategy was launched, there have been many new scientific and policy developments that are helping us to move forward. These include a deeper understanding about how people living with HIV in the United States are accessing care and how that care affects their long-term health.
Of the more than 1 million Americans with HIV, only 82% know they are infected. That means 18% are unaware of their infection. That's more than 200,000 people. 66% were linked to HIV care. 37% have stayed in care. 33% are receiving treatment. And only 25% have the virus effectively controlled, which is necessary to maintain long-term health and reduces the risk of transmission to others.
The ultimate goal of HIV care is to suppress viral load, but only 1 in 4 people living with HIV makes it all the way through the care continuum to achieve that goal.
So our challenge is that not all people living with HIV are getting the full benefits of treatment.
In light of these new developments, today the President issued a new executive order directing federal agencies that implement the strategy to accelerate efforts to increase HIV testing, enhance linkage and engagement in care, and improve treatment outcomes. These actions will help us reduce the drop-offs along the HIV care continuum and help us meet the goals of the strategy.
And by meeting the goals of the strategy, people living with HIV will live longer, healthier lives.
As a person living with HIV, I understand these challenges. There's no simple solution, but we can use this opportunity to do better, to feel better, and to live better.
Together, we will identify opportunities to address gaps and barriers and improve outcomes along the HIV care continuum. This initiative will engage the federal government,
researchers,
providers,
and people living with HIV and others to work together to accomplish the goals of the strategy.
So we've got to keep pushing. We've got to make access to healthcare more available and affordable for folks living with HIV. We've got to implement the protections in the Affordable Care Act.
Each of us has an important role in national efforts to improve the HIV care continuum. Each of us can help to make the 1 in 4, 4 in 4.